Are you thinking of starting a family? Then pre-pregnancy planning is the best gift you can give to yourself and your unborn baby. This video is to make the ride a jolly one for you. Pregnancy is a 9-month project. It takes 40 weeks for full-term pregnancy. And so for any good project, you have to have a plan. You don't just bump into it. If you want to embark on a journey of 2 days, you have to plan on how you're going to get money to pay for your ticket, or your transport fare, or your accommodation and feeding. How much more a project of 9 months? That is why you have to plan for the pregnancy. It is called pre-pregnancy or preconception plan. Let's make this journey a smooth one for you. Why do you have to pre-plan for your pregnancy? Pre-pregnancy planning is preparing your body, your mind, and your lifestyle for a safe and healthy pregnancy. It is the best gift you can give to your unborn baby. How do you start planning for your pregnancy? The first step is to schedule an appointment with your doctor. You and your partner should go and meet your doctor. At the doctor's office, you will discuss your medical history. The doctor will ask you if you're hypertensive or diabetic or asthmatic, or if you have any genetic issues. Are you epileptic? How about the blood group of you and your spouse? Are they compatible? Is your husband rhesus positive and you are rhesus negative? Those details are very important. It helps in knowing the best options for you during pregnancy. Your obstetric and gynecological history, your social history, your family history, all are very important. The doctor will also ask you about your lifestyle. Do you take a lot of alcohol? This is the time to stop. Do you take drugs, hard drugs or prescribed drugs? There are drugs you will not take during pregnancy, and if you're on hard drugs, you need to stop. There's what is called fetal alcohol syndrome. So if you're a woman and you drink a lot, your baby can get intoxicated. How about your weight? Do you have normal weight? Are you overweight or underweight? Both are not good. You have to maintain normal weight. Engage in exercises. 30 minutes walk every day is enough. Then we'll talk about finance. Money is very important in pregnancy. You need money for your antenatal care. You need money for delivery. You need money for baby things. You need money to eat the right food. So you start saving on time for your pregnancy. Then you have to research your options. Which hospital are you going to use for your antenatal and delivery? If you have health insurance, find out your coverage. Are you covered for antenatal care? Are you covered for delivery? Are you covered for both? Before pregnancy is going to find out all these details so that you won't be taken unawares. How about diet? You need to be on balanced diet. You eat highly nutritious food. Foods that are rich in vegetables and fruits and protein. Reduce taking sugar-rich foods. Your doctor will place you on folic acid that will help to prevent neural tube defects in babies. Cut down on sugar, because sugar will help you to add weight. You don't want to bring forth a baby that's overweight. How about your emotions? Pregnancy is a roller coaster of emotions. That is when you have to discuss with your husband. Your husband will have to know that during pregnancy, your mood will swing. You could be happy 1 minute, you're irritated. How about food cravings? In pregnancy, those foods you used to cherish, you no longer want to eat them. And those foods you don't used to like, those are the ones you crave. You and your partner have to understand all this. The hormonal changes that take place, the emotional swings, the toll pregnancy will have on your finances. How about stress? You have to start planning on how you're going to manage stress. If you're somebody that you don't have enough time for yourself when you're not pregnant, you have to give it a thought how you're going to manage yourself during pregnancy and childbirth. You might need to bring help. You might need to arrange for your mother or your relations to come stay with you and help you. You might need to switch jobs. You might need to start planning on how you're going to stay and take care of your baby when the baby comes forth. So you have to put all these things into your plans so that it's not a sudden something. So you see, a little planning goes a long way to having a very stress-free pregnancy. This period of pre-planning also helps you to understand your partner. If you watch my previous video on before you say I do, there are certain things you have to sit down to understand before you say, yes, I'm going to marry you. Some of these features come up during pregnancy. Is your husband tolerant? You have to start learning and managing your emotions. So plan well for your pregnancy and you have a jolly good ride throughout your pregnancy and you bring forth a healthy baby. If you plan well before pregnancy, you will not have any difficulty during your antenatal care and during delivery and even postpartum. Pre-plan your pregnancy and you will enjoy your antenatal and delivery period. Share this video with women that are about to get married and those that are already married and planning to get pregnant so that they can plan and not be taken unawares. It is a 9-month journey. I wish you happy pregnancy and safe delivery.